For more on the current state of the pandemic, Dr. William Haseltine joins us now. He's the chair and president of Access Health International, also the author of the new book, Natural Immunity and COVID-19. Welcome back to the show, Doctor.
Thank you.
So let's start with the situation in Shanghai. Where do we stand in terms of getting basic needs to citizens?
Well, I have an office in Shanghai, and I was just on the phone a few minutes ago with some of my people there. They're having difficulties. As was highlighted in your presentation, a lot of the services that existed to call in for food and supplies have disappeared. They're just not there. But the local street-level governments are supplying some food to people. For example, my staff is receiving bags of food from their local street-level government, and that's tiding them through. There's also very good spirit in the various housing complexes where people are helping each other. So it's difficult, but still managing.
Good to know spirits are high. What is the concern, Doctor, of COVID-19 flare-ups in other Chinese cities and possibly subsequent lockdowns there as well?
Well, it certainly can happen. This is a virus 10 to 12 times more infectious and transmissible than the first wave of the Wuhan virus. If it can be contained, I'm confident that the Chinese government will do it, but it's a much more difficult task.
There is, of course, the public health imperative, but what are the economic ramifications of this ongoing lockdown? Do you see supply chain issues getting worse? Inflation globally affected?
If you don't control this infection the way it can be controlled through the way the Chinese government is now doing it, the economic consequences will be far, far worse.
So shorter pain for long-term gain. Doctor, there's also a debate about booster shots. To what extent do these boosters need to be retooled to take variants into account? And how long will these processes take?
Well, so far, the boosters don't have new variants in consideration, and they don't seem to need it to provide at least short-term protection. I'll give you some of the very recent data just out from the Israeli studies. A fourth booster will protect you, even from Omicron, about 50% of the time. That's pretty good odds, considering that it's close to zero protection if you don't get the fourth booster. Secondly, it will dramatically improve your chance of surviving if you do get infected. So, and when I mean dramatically, it reduces it to a very, very low level. And so I certainly have recommended to all of my friends that are 50 and over, get the fourth booster. And I'm considering a fifth shot because, in matter of fact, the vaccines that we have now, even our very best vaccines, don't last to protect you from infection more than 3 or 4 months, but they also can help you very much if you do get infected, prevent serious disease and death. So it is an absolute must to get the best vaccines you can and make sure you're fully vaccinated about every, I would say, 4 months at this point.
Doctor, we seem to continually just play catch up with the virus as more variants emerge. Should we be worried that we seem to always be one step behind?
Well, we are one step behind, but some people and some countries are 10 steps behind. So we certainly have got to keep up with the changing situation. We've got to make sure the populations are fully and recently vaccinated. Fortunately, there are a lot of new drugs on the horizon that should you get detected by being infected early, you can take these drugs and reduce your chance of hospitalization very, very dramatically. And let me say there's a new Chinese drug, or a drug that's been approved or is now available in China. There are new drugs in the US. There's a whole series, and we're starting a very inventive program, which is called Test to Treat. You go to a pharmacy, you get tested. If you're positive, you get a prescription of drugs right there. And that is critical, because what saved your life and saves you from hospitalization is being treated early.
Right.
Test to Treat is probably the most innovative medical procedure that I have heard of in the last 10 or 15 years. It can make an enormous difference. I hope China adopts it. You have the drugs, you have the testing. Test to Treat is a very powerful solution to reducing the impact on the nation's health.